Hey everybody, what's going on? It's your boy Porkchop, 92 Q's on from the Quicksilver Morning Show. And I'm glad we are here today because we are doing something great for the community with the help of my girl, Miss Lindsay Goff from the University of Maryland Medical Center. How you doing, Miss Lindsay?
I am great. How are you? Thank you so much for the invite.
Listen, we're going to have fun today talking about something that's near and dear to my heart and of yours about stroke.
Yes,
Now,
sir.
we done talked a lot before we got on live.
Yes.
For people that's going through stroke, what is a stroke?
So, a stroke, to put it in the simplest terms, is an interruption in blood flow to your brain. So, that can be from two reasons. It can be from a blood clot obstructing the blood flow, or it could be when a vessel ruptures and that blood suffocates the surrounding brain tissue.
Hmm.
Sounds morbid.
Yeah, I was going to say I had two in my life, and they were back to back. One was in August, one was in October, and I still can't even remember what happened. Even listening to the doctor, I know I had a stroke.
Yes.
And are there different types of strokes?
Yes, so there's two separate types of stroke. Like I said, one is a clot stroke. We call that an ischemic stroke. That is 88% of our strokes nationally. Our second type of stroke is called a hemorrhagic stroke. So that's where that that vessel ruptures and that blood that comes from that vessel sits on and suffocates your brain tissue.
Okay.
You've also heard of a mini stroke. I'm sure a lot of the public has heard of a mini stroke. And to clarify, what that is, it's an acute onset of neurologic symptoms. So it looks like a stroke and it sounds like a stroke. The difference is that the symptoms completely and 100% resolve within 24 hours. Generally within 30 minutes. But again, that's your body's way of, giving you a warning sign that you have a clot sitting somewhere. And unless you modify your risk factors, it's going to get stuck.
Oh, man. So can you help me explain the two I had? Because I thought they was very different. So I can't even remember what the doctor told me, what type it was or what happened. The first one, I was DJing at a club.
Mm-hmm.
And I noticed I wasn't hitting the buttons on time. I felt like I was off.
Mm-hmm.
And then the next thing I know, my speech was terrible. Like it was really slow.
Mm-hmm.
I didn't know what was going on. And through the grace of God, I was gonna go home. But I went straight to St. Agnes, and the lady, the receptionist nurse or whoever she was,
Mm-hmm.
she didn't say a word. Like as soon as I walked in, she walked around the counter and she said, "Sir, can you smile?" And this side of my face didn't move. Like I smiled over here. And she was like,
Yes.
"Oh, you're having a stroke."
Yes. So it's, unless I saw your imaging of your brain, I can't really definitely determine if it was a bleeding stroke or, a clot stroke. From what it sounds like, I mean, you have the risk factors for both, but did they give you the clot busting medicine?
Don't even ask me. That was the first stroke was very weird to me. I know they gave me an MRI. As soon as when they pulled me in the back, they didn't even take me upstairs. We went straight to the imaging.
Yes.
And I remember seeing my brain and remember seeing a white circle that was
So,
like right here.
so a white circle and on imaging and on a CAT scan, that's actually bleeding. So it sounds like you did have a hemorrhagic stroke, which
Mm.
the biggest risk factor and cause for a bleeding stroke or a hemorrhagic stroke is elevated blood pressure. So it
They
sounds
said
like that was your risk factor.
they said my blood pressure was 230 over 220, and it took them a week and a half to bring it down. It wouldn't go down. No,
Yeah.
I didn't know what was going on. I didn't know why my blood pressure was so high, and I didn't know why it wouldn't come down.
That's because your body is so used to living in that elevated blood pressure range. We want to lower it, but we can't lower it, very fast, very quick, because that can also have some, detrimental effects. But, your body, when it's used to living in that elevated blood pressure realm, it's very, very hard to get your body to learn how to live in a different space with a lower blood pressure.
For those that's just joining, and I'm talking to Lindsay Goff, let me make sure I give you all your accolades. Registered nurse?
Yes, sir.
And what is BSN?
That's my Bachelor's of Science in Nursing.
You better say it, lady.
The most expensive piece of paper that I have until I'm done grad school.
She is representing and coming from the University of Maryland Medical Center Midtown campus, and you can give them a call if you have any information or any questions about stroke at 410-225-8000. Now, Lindsay, the second one was maybe not 30 days later. It was October 20th.
Wow.
I get up to go to church and fell right in my bedroom floor.
Wow.
My left side was completely like numb, or I couldn't move it.
Wow.
So when the doctors came, when the paramedics came, because you also a paramedic as well.
Yes, I've been a paramedic for 12 years. Yes, sir.
That's right. Give you all your accolades, man. And
I have the best job ever. I combine all of them: ER, nursing, paramedic, and a stroke coordinator. So I truly do have the best nursing job ever.
And Dr. Cumming.
I got to win the lottery first.
So the paramedics came, and now to this day, my left side, I don't have taste. My mouth is numb. All is feel weird. I don't have touch in this hand. Arm it feel hot. Like my whole left side is just weirded out. What type of stroke? And when they showed me the picture, same thing.
Was a white spot.
White spot directly across from the other one.
So that sounds,
they was right next to each
so
other.
that sounds like another bleeding stroke. And when your brain has a stroke or an area of bleeding in that right side of your brain, or the left side, it's going to affect the right side, just because that's how the nerves, and how the nerves and cranial nerves in your brain, the left side of your brain innervates the right side of your body. So there are some strokes that can affect both sides, both legs, but generally, if you have a stroke on the right side, for example, it will manifest in symptoms on the left side. We have to make it very confusing in neurology. We can't just make it simple.
Right. And I knew growing up, being in school, that the left side controls the right and the right side controls the left.
Yes.
As a personal question for myself then, since I had those two, what are my risk factors of having another one?
So in, the world of neurology and per the AHA, when you have one stroke, whether a bleeding stroke or, a hemorrhagic bleeding stroke or an ischemic clot stroke, if you do not modify your risk factors, you're 40% more likely to have another one. So, as time goes on, you are still at risk of having more strokes. And that's why it's very, very important to modify your risk factors and continuously modify your risk factors.
And what are some of the risk factors I have to modify?
So there's two types of risk factors. I'm glad you asked. So the ones that you want to focus on are your modifiable. So these are the things that we can change. We can eat a healthy diet. We can drink lots of water, get good sleep, control your blood pressure, your cholesterol, your diabetes. You're going to eat healthy. Not a lot of salt, not a lot of sugar.
No.
So those are the easy things to modify. So those are the things we can change. When we look at non-modifiable risk factors, these are things that people are born with. So this is your age, your gender, your ethnicity, your family history. Unfortunately, these are things that you can't change. So they are going to increase your risk factors. So when we look at the things that we can change, the modifiable, we need to focus on those, especially in your case. Your blood pressure is the biggest thing.
And it's good right now. Right now, I can tell you my blood pressure is A-OK. Thank God.
Probably better than mine.
And one to double back about you saying blood pressure, they said the 4 reasons why I had strokes anyway was my number one reason. They said because of stress.
Yes.
They're like, you are going to stress yourself out, buddy. You got to find a way to relieve that. But the body reasons were diabetes, high blood pressure, and cholesterol.
Yes. Those are the 3 biggest things that we see, especially, when we're looking at different ethnicities. African-American males are 50% more likely to suffer, a very devastating stroke and also to, die from a stroke. So, those are inherent risk factors, the non-modifiable things that you are born with. So then we need to look at, risk factor modifications specifically for, each ethnicity, each, gender, age. We look at every single person to see what individual risk factors we can, modify to prevent, a larger event or another stroke.
Well, thank you for giving me the stress factor back. I appreciate it.
Awareness, you have to be prepared.
Right. Speaking of being prepared, if someone out here is watching, how can they tell if somebody's having a stroke?
So that's a great question. And this is what I wish I could put on every billboard, every, magnet on everyone's car to put on the back so that sitting at a stoplight, you could remember it. So what we use and what we teach across the country and across the world, it's called a BFAST algorithm. So, BEFAST.
Okay.
So the B stands for any acute onset of any balance issues. So this is feeling like you're walking sideways or you're walking drunk or, the room is spinning in a circle.
I swear to you, my first stroke, before I even got to the club that I DJ'd at, I was pulling my equipment. I was doing a baby shower. So I had my equipment. And when I went to my car, I kept pulling to the right. Like I was walking, but I felt like I
lean. Yep. So that's a huge one.
My friends was laughing at me. They were like, "You all right?" Because we didn't know.
Yes. But people think that you're drunk.
Nurse. So now I get to call and let her know you're a bad nurse. You're terrible.
But it's dizziness and gait abnormalities are 2 of the biggest missed symptoms in any emergency room nationally. Mm-hmm. So, we look at patients that have migraines and have vertigo. They mimic acute strokes, right? And that's me as well. But, can you still have a stroke when you have vertigo or you have migraines? Yes. And that is what we need to change as a healthcare system, as a culture, to look at. When we look at dizziness, we look at, gait abnormalities, we're looking at feeling off balance. Mm-hmm. When I see these patients coming to me in the ER, I ask them, do you have a history of migraines or vertigo? When they say yes, my next question is, does this feel similar to your previous migraine or vertigo episodes? And I look and I ask that question because there's a reason why they called 911. There's a reason why they came to the emergency room, despite taking their medications. And 9 times out of 10, these patients tell me this feels more vigorous. I don't know why vigorous is the word, but a lot of my patients say it feels like, they're standing on an earthquake, or they have an earthquake in their brain, or one that I hear quite frequently, which I find very odd, is they feel like they're sitting in a car that's going 200 miles an hour, but they're not going with the car.
I understand fully.
So yes, and it's, and these symptoms can be vague, especially if patients can't communicate them right, or just don't know how to put it into words. So they can be missed. And dizziness, like I said, we look at room spinning dizziness. We're not, as concerned with lightheadedness, like you feel like you're going to faint. There's a lot of things that can cause that, but an acute onset of room spinning dizziness is a stroke until proven otherwise.
Like my vertigo is so, I wouldn't call it so bad, but it's bad enough. I can't bend over and pick something up off
Without,
the wall.
yes, without it, sparking.
And be like, uh-oh.
Yeah.
Yeah.
Don't do it.
Yeah, I'll be like, call my son. Dad, let's come pick this sock up.
Mm-hmm. But
So that's the B.
Yes. So
Now
that's the B.
We got 5 more letters, right?
Yep. So all right. So we got the B. We should have put those on the bottom of the screen. I should hold up a sign.
Right.
So the next one we have is the E. So that stands for eyes. So again, we look at loss of vision, acute loss of vision. And what patients tell me is it feels like a dark or black curtain is coming down or up. And it can even just be in peripheral vision or half of your visual field of one eye.
Mm-hmm.
But again, acute onset of that is concerning. You can have, a retinal artery occlusion. So that artery behind your eye, you can have a stroke there. So,
Wow.
So we have the B.
We got
we have the E. I think the eyes are pretty easy, right?
Yes.
So then we have the F, which stands for face. So it sounds like you had this symptom with facial droop.
Yes.
So we're looking at one side of your face is numb and you can't move it. So we have these patients smile.
Yeah.
And we check for equal tone. We also have them puff their cheeks out. Check for tone. So also when you're looking at face, we have them stick their tongue out and we ask them to move it left to right. And, a lot of times, patients are able to do this, but there are some strokes that will cause tongue deviation. So when they stick their tongue out, it'll deviate to one side or the other.
Okay.
Scary, right?
Yes.
It feels like, Novocaine, and when you try to drink out of a straw, it's going to fall out of your mouth. But you would be shocked at how many people just say, I'll go to sleep, I'll take a nap and see how it is when I wake up.
And that's what I was about to do before I went to the hospital.
I'm so glad that you didn't.
I said, let me go lay down. And then by the time I got out the tunnel to get to Caton Avenue, something said, go ahead and go to St. Agnes. Just to
so you were able to drive still?
Yeah.
Wow. And that's
everything else was weird, though. I couldn't believe it.
And if you got pulled over, and I've had patients tell me when they're having strokes that, cause that off balance, they are pulled over. They are, doing a field sobriety test. And will they pass it? No. But, that's also important for police officers. They need to recognize signs and symptoms of stroke and being able to determine the difference.
So for anybody that's just tuning in, we're talking about stroke. We're with Lindsay Goff of University of Maryland Medical Center Midtown campus. Please drop a question in the comments for her. I know she's going to have all the answers. And right now, we're talking about BFAST, which the B is for balance, the E is for eyes, the F is for face, and the A is for what? Is it A?
Yes. Yep. You are right. See, you already know the algorithm. This stands for arms. So we look at, is one side of your body, are you able to lift one side normally, your arm and your leg, but then you're not able to move the other one? It's like a Frankenstein arm.
Yep. I remember that.
Yep.
I remember that.
But it's, again, there are some patients that have, obvious one-sided weakness, and then there's others that only have a loss of sensation in one side of their body, but they have full strength. So, again, neurology and stroke patients all present differently. They never are clear-cut examples. But when we look at unilateral, so one side of your body is affected. But there are some types of stroke that can cause bilateral or both sides of lower extremity, so both of your legs going numb and weak at the same time. So, how do we determine if both of your legs are going numb? Any acute onset of any neurologic symptom like that is a stroke until proven otherwise.
Got you. So
So
that explains this. My second stroke when I got out the bed and my arm and leg on my left side just was gone.
Yep.
I fell straight to the ground and I couldn't get up. I couldn't move.
And it feels weird. Didn't it feel like it wasn't attached to your body?
To be truthful, that's how my leg still feels. Like when I'm walking, my neuropathy and the feeling in my left leg is very weird. Like I can't walk far at all. Or I'm gonna need a cane to actually walk. And even with the cane, it still feel like it's like I'm working overtime to do something that I could just walk to the car. But now when I walk to the car, I stop, I go down steps one at a time, go up steps one at a time.
It's hard. It's because, when you have a stroke, whether it's that clot obstructing the blood flow or the bleeding stroke, your brain is used to perfusing itself in a clockwise fashion. When that gets interrupted, it has to find a longer way counterclockwise, and it has to take back roads. We call it collateral circulation. But that's why your brain is truly trying to figure out how to move that part of your body again.
Walter Brown said, I had pain in my neck, both sides. I guess that's during the stroke. And I'm here as we could hold up. Before we go to Walter, let's finish B fast.
Yes. Okay. So we have the B, acute onset of any balance, feeling off balance, coordination, also the worst headache of your life. I think people do know that one.
Yeah.
E is for eyes. So losing vision, even if it's one part of your peripheral vision. The face. So if one side of your face is drooping or it's numb, we also look for drooping of the eyelids. That's called ptosis. So, we have something called Bell's palsy that just affects your facial nerves. So, that is a stroke mimic. But when we look at these patients, if it's just isolated to the face with nothing involving the eye, then that's generally Bell's palsy. But if we see some facial droop, it's numb, they're biting their tongue, they have a drooping eye, they aren't able to smile and one side's drooping like the Joker, then that's indicative of a stroke. Wow. So we have the A, which is arms, like we talked about. So one side of your body going weak, numb, unable to move it, acutely. So then now we're to the S. That speech.
Yes. They get you to read the words in the book, and I sounded crazy. Both times.
It's mama, tip top, 50-50, huckleberry. Yep.
Yes.
And so when we look at speech, and this is honestly next to losing vision and mobility, speech is one of the most debilitating symptoms of stroke, in that, especially for you and I mean, we do a lot of public speaking in our careers. So, having the inability to be able to do that, that's life altering. So when we look at speech, there's two types. We call it aphasia. There's expressive aphasia, meaning you know what you want to say, you have it in your brain, but when you go to say it, it comes out
every day. When I'm at work on the radio, what people don't see, Lindsay, is when I'm trying to speak or talk, or I call it my ADHD moments, but it happens so much that I think it, but it don't never come out until it does, and then it comes
out. Yeah. Yep. So that's expressive aphasia. The second type of aphasia is called receptive aphasia. So this is the inability for your brain to comprehend what is being said to them, or being able to comprehend what's happening around them. So if I said, "Hi, DJ Porkchop, how are you today?" you would hear "rrr, rrr, 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 rrr."
Oh, thank God it ain't that.
So again, patients can have both. Generally, sometimes, a lot of times they don't have both, thankfully. But how are patients that have that, receptive aphasia and they're unable to communicate, how do they advocate for themselves?
Right.
It's a very difficult thing. And, trying to live like that, it's like being locked in and you're, stuck in your body, but you can't advocate for yourself.
Yeah.
So that's, yeah. So speech is, thankfully a lot of patients get speech back. It's very few and far between now that we, have the treatments that we do for stroke, that these patients are, getting feeding tubes like they used to, 10 years ago, 15 years ago. But, when we look at the BFAST algorithm, so we have the B for balance, we have the E for eyes, F for face,
yes,
A for arms,
yep,
S for speech,
and T. T. It ain't talk. It's got the F. Time.
Yes. And this is honestly the most important part of this algorithm is time. So when we say time is brain, it truly is a, time-sensitive emergency in that every minute your brain is not being perfused, whether it's from a blockage from a clot or from an area of blood sitting on that tissue in your brain, you lose 1.9 million neurons. And that damage is irreversible. The brain is the only part of your body that we can't transplant. So I could, get anybody's kidney, anybody's liver, I could put your face on my face if I truly wanted to, but there's no, I don't know. You're one of celebrities for me. So
listen, you don't want this face. They be like, damn, you got
all this hair.
Oh, I take all your hair.
You can have it. I have some extra.
Yeah.
But when we look at, that area that is damaged, so 1.9 million neurons every minute. So that damage is irreversible. So, the brain is the only part of your body that doesn't shed out that dead tissue. So, people that have had strokes and multiple strokes, we can see that on their imaging, even years down the line, because again, your brain doesn't grow or heal itself like a broken bone does. And that's the scary part. And that's why time is very, very important, because we have treatments for stroke that we didn't have 10 years ago. So I'll go, very general into it just as why time is brain. But the importance with time is brain is as soon as you recognize any of those BFAST symptoms, you need to call 911 immediately. Don't lay down and take a nap. Don't go to urgent care. Don't wait and call your primary care. Don't drive yourself. Call 911 because, medics can recognize stroke symptoms, but they can also alert the hospital while you're on the way. So when the medics consult in the emergency room, it overhead pages in the entire hospital. So it gets ICU ready, it gets the pharmacy ready, it gets the ER ready, it gets, the stroke team, which is myself, my neurologist, ready. It also clears the CAT scan table. So if you don't learn anything else from this presentation, please, please, please call 911 if you recognize these symptoms in anyone or yourself, because time truly is brain.
For everybody that's just joining us, we are here live from 92Q. We're live on Magic. We're live on Praise, on every Radio 1 Baltimore social media, building up the health of the community, stroke awareness and prevention provided by University of Maryland Medical Systems. You got a question or comment? Put it in the chat right now. And we have the lovely Dr. Lindsay Goff in the building. She told me don't call her doctor, but still, I
don't want that responsibility or that medical debt.
Yes.
Debt.
So we got to be fast, right? How do a person like me that went through strokes, what's the care now? What do I have to do after these strokes?
So there's a lot of work that these patients have to do. It's not just, surviving the stroke, that initial stroke. It's maintaining and modifying risk factors like we talked about. But, like we discussed before we went live, it's seeing doctors, you're seeing many doctors. This is cardiology, neurology, your primary care, endocrinology, nephrology. So, that's a lot on someone, especially if they can't drive. But it's also, yep. So it's compliance with medications. It is truly so important. And it's something that nursing, doctors, nobody stresses enough. Taking your medication every single day as prescribed and not missing it is how you're going to prevent another stroke.
As a person that takes the pills like me and you talked about, I take maybe 20 something pills a day. And for the diabetes, since I have I forgot the actual name of the diabetes I have, but my body don't produce enough insulin. So I got to take 2 long acting, 3 short acting. And with the pills, it's sometimes mentally tiresome to have that a lot and every day.
And that's getting them, filled. That's getting, to see doctors every single month, every 3 months to get those filled. So, not just keeping up with your medications, it's also, looking at your diet. It's modifying. None of us have a 100% Mediterranean diet. I am the skinniest person with high cholesterol, but I still even have to look at what am I eating every day? Right. We're looking at, the food groups. You have to make sure we're eliminating any fatty foods, any fried foods. I know I hate that. I'm Italian. I can't give up pasta. I can't give up garlic bread. But it's, in moderation. So it's taking your pills. It's taking your pills. It is, having a healthy diet. It's exercising. But after a stroke, how motivated are these patients, or how motivated were you to get up and exercise every day?
My problem was the body itself can't do the exercises like it used to. And I feel like as a stroke, you told me don't say the word victim, right?
Survivor.
As a stroke survivor, trying to explain what I can and can't do to a friend or family member that's trying to help as a trainer or whatever you would want to do, most people, they don't understand that you can't do certain things like you used to. Like my mobility is very bad. Like that's why my balance is off. I'm always holding on to something. It already weakened my arms and shoulders and my neck, my lower back, the leg, like every part of me is just weaker than it usually is. Is it something we can? How do we tell our loved ones? Yeah, I want to go to the gym tonight, but it just
And that's something that I have a stroke support group that I'm very happy that you're going to join us next month because you will love it. And this is something that my patients tell me about. I look normal to, everyone in my life before the stroke, but they don't understand that I had a stroke and how that affects me every day. So patients that just have speech deficits, they're afraid to talk because they can, do everything else. But as soon as they go to talk, that's where they can tell the difference. But, when it comes to outward physical deficits, we look at it's a lifestyle change. You can't do what you used to do, especially, young, men that like to go to the gym. That's going to change their gym routine drastically.
Is age a factor? Age isn't a factor in strokes, correct?
Any person at any age can have a stroke. And that's the biggest myth, is that young people cannot have strokes. They can. And, children have strokes, babies in utero have a stroke, adolescents, a lot of 20 and 30-year-olds, all the way up until death. Anyone at any age can have a stroke.
Another question I wanted to ask you before we go any further. My doctors told me well, after both strokes, when I had to I had to relearn to walk because of the balance. I was a fall risk both times in the hospital, and we had to walk around the floor, walk from my bed to the bathroom. They also said something about me having seizures. Then I started having seizures in November. So it was maybe a year from the strokes to the seizures. Why is that a part of the stroke?
So there's a lot of different reasons. I'll try to make it as simple as I can to answer that question. So when it comes to bleeding strokes, the type that you had, they're a higher likelihood to have seizures. And what a seizure is essentially is your body recognizing that something is not, at that homeostasis, at that normal level, and it's trying to reset itself. So a lot of patients that have hemorrhagic strokes, bleeding strokes like you did, we put them preventatively on anti-seizure medications. When it comes to, clot strokes, we see seizures in these patients when they are very large areas of dead tissue. Okay. So again, that's the brain recognizing that there's a big area that's not working. So I'm going to have a seizure to reset myself.
Wow.
But it's very hard because not every single person that has a hemorrhagic stroke have seizures. But also, the timing of seizures is not always the same in every patient. They could have seizures immediately after a stroke. They could have it 6 months after a stroke. You had it a year after stroke, and that's scary because it's not every person is the same. Not every stroke, not every brain is the same, unfortunately.
Yeah, what was very weird, they told me I had 4. One at the restaurant, and I was with my son, which really breaks my heart because he had to see it.
Yeah.
I didn't know, like you said about the curtain, it felt like everything went grayish white. Like it felt like a reset, like I went down.
Like an aura, yeah.
Yeah. And they said I had 1 at the restaurant, 2 in the ER, in the ambulance, and 1 at the hospital.
That you don't remember.
Don't at all. Nothing. We got a question from Courtney Drake. Are you more likely to have a stroke if an immediate family member or parent or sibling had one? Is it hereditary?
Yes, so that's a great question. So when we look at those non-modifiable risk factors, so those things that you're born with, for example, my cholesterol is high because it runs in my family. That's, it's just a genetic thing. But when we look at high cholesterol, diabetes, vascular, how your vasculature is, made up, and the how well we want it to be like a slip and slide to go through your vessels. But, when you have diabetes that is a type 1 or, that you inherited, it can cause that vasculature to become, like trying to put an inner tube on sand, and then they get stuck. But so when we look at patients that have a, high family history with a lot of heart attacks, a lot of strokes, we're going to look at the modifiable and non-modifiable risk factors that will increase that risk. But yes, if you have a family history, a strong family history, it's indicative that you need to modify risk factors so that it doesn't happen to you as well. That's a good question, Courtney.
To make sure we give out your information about the group, tell us when it is and how can someone be a part of it?
So the 3.5 years ago when I took this role over, in all the way up in Harford County at Upper Chesapeake Medical Center, at way up north in Harford County, I looked at what is the need of the community. And in the University of Maryland system, we have a pretty high volume for stroke up here. So when we looked at the need for a stroke support group, there was a high need. We had a lot of patients and they didn't know where to go. These patients are afraid to go to therapy. And like we talked about, not everybody understands what you're. I started with 3 patients 3.5 years ago, and now I have 20 to 30 stroke survivors, their spouses, their caregivers. I have, sons, daughters of family members that have had strokes in the past. And it truly is the most amazing thing that I've ever seen in my career, because these patients not only teach me what patients need in the hospital and need in the community, they also mentor each other. So, they feel isolated after you have a stroke and you're experiencing these very weird symptoms that, you can't explain to your spouse or your son, your daughter. How do you talk about it? And that's very hard to do unless you're talking to somebody else who understands. And these patients, truly, their mentorship with each other helps them more than I ever could.
Wow.
So this group, if anybody would love to come, it's the second Wednesday of every month from 10:30 until 12 noon at Upper Chesapeake. It's next to the main lobby. So you can visit our website. You can Google it. It's on the AHA website. We can also, blast it out here for everyone. But if you know someone that's had a stroke, if you've had a stroke and you don't know where to go and you're, hesitant to see a therapist or therapy medications aren't working, find a stroke support group. And it truly does help. And those patients truly are why I do my job.
Can they call the number that's scrolling across the screen to get in touch with the group?
Yes. So if you call that number or visit any of the University of Maryland websites, we have all of our stroke support groups listed on there.
Don't forget, it's the University of Maryland Medical Center Midtown campus, or you can visit www.umms.org or call the number at 410-225-8000. All right?
Or the AHA website, the American Heart Association, lists every single stroke support group by state, by county. So no matter where you are in Maryland or outside of Maryland, use that website as a resource.
And I hate to bring this to the people that are watching, and I know Lindsay is going to back me up 100%. Smoking. Yep.
Big no. So
go ahead.
So smoking, it does a lot of damage, and it can cause an increase of buildup of plaque, especially in your big carotid artery right here, which can cause that plaque in your neck. Pieces can break off and travel to your brain. Smoking also makes your vasculature, like I said, you want it to be like a slip and slide, slippery, watery, but smoking dries that up and can cause your vessels to be hardened, and which will cause pieces of plaque or blood clots to get stuck in there. It can also cause a weakening of an area of vasculature, which repeated pressure from high blood pressure can cause that weakened area to rupture and cause a hemorrhagic stroke.
I remember, and I'm an open book, Lindsay. I was smoking marijuana, and then I had one doctor was like, yeah, any type of smoking is bad. No matter what it is, smoking is smoking to the health community.
Yes. So honestly, smoking, also secondhand smoking, it can increase your risk. So any repeated exposure that you inhale, even if it's secondhand, that's puts you at risk. So smoking, if you know someone that smokes, please, please, please encourage them to quit. There are a lot of smoking resources within the University of Maryland, or smoking cessation resources within the University of Maryland medical system. So please, please, please utilize that. But smoking is the number one. Do not do it.
What types of treatment or medication is there for somebody that deal with strokes?
So when we look at preventative treatment, we can place patients on a blood thinning medication. So a Xarelto, an Eliquis, a Coumadin. We save that for clot strokes. And if we see an irregular heartbeat or AFib, that's the largest risk factor for having a clot stroke. Wow. So we put those patients, preventatively on an anticoagulant. And we can also put them on aspirin, Plavix, which are platelet inhibitors. I know this sounds, way out in left field, but It helps the platelets not be as sticky to form blood clots. We can also place patients on, if their bad cholesterol numbers are, greater than what they need to be. So I think the AHA now has a standard of 55 for your bad cholesterol. We'll put them on a high intensity statin to help.
There, 55, baby.
Yep, almost there. My cholesterol is not that good, but I need to modify my risk factors.
And I'm glad you said that you're going through your own things about your own body to let people know that you said that it's 50% for me because of my African American. But what are the risk factors for a woman for stroke?
So men and women both share the same risk factors for heart attack and stroke. So when we look at, risk factor modification, we're looking at, things we're born with, your race, ethnicity, their genetic factors. A big one is sickle cell. There's a lot of people that don't think about sickle cell as a, non-modifiable risk factor for stroke. A lot of sickle cell children are at risk for stroke because, their red blood cells are shaped like jacks. But, it can be men, it can be women that have sickle cell, and have that risk factor. African-American men, like we talked about, are a 50% more likely to have a devastating stroke and to die from a stroke. And is that because they're more stubborn? Maybe. I'm just kidding. But, is that something that we need to look at? Yeah.
Yeah. Because African-American men don't go to the doctors as much as we should.
Exactly. So listen to the women in your life.
Then you going.
Yes. But it's, when we look at those risk factors for heart attack and stroke, it's the same for men and for women. It's just those statistics, unfortunately, that's, it tips on that scale. But we need to look at every ethnicity, every gender, every age, because anyone can have a stroke. Anyone.
Lindsay, I love you. I'm going to see you next Wednesday. So we have a good time. I'm bringing nothing but Mission Barbecue. Because that's going to be
wow. They will love you for that. These are no mac and cheese, all greens and beans.
Okay. All right, I guess. You can make sure you make that phone call to 410-225-8000 for any information you have. And big shout out to University of Maryland Medical Center, Midtown campus. And where are you at again?
I'm at the University of Maryland Upper Chesapeake Medical Center in Harford County.
And one more time, give them the information to join the group.
My stroke support group, again, is the best group of people that you've ever met. In this group, I have writers, I have Vietnam War veterans, I have pilots, I have pharmacists, I have ESPN producers. It is, like I said, anyone truly can have a stroke at any age. But so,
that's a DJ.
Yes, and now I have a DJ.
Yep.
So, when we look at when is the stroke support group, mark your calendars. It's the second Wednesday of every month from 10:30 in the morning until 12 noon.
Can you give us, we always know about, we got to always eat healthy. That's for anything.
Yes.
Anything in life you want to, whether you're having heart problems, kidney problems, liver problems, leg problem, arm, fingernail, whatever it is, a balanced diet is the only way to go, correct?
Yes, sir. A balanced diet, lots of fruits, lots of vegetables, high protein. What I tell my patients after they have a stroke, a high protein diet is what your brain needs to be able to replenish itself. So, if your body doesn't have protein and eats all fats and all starches, there's nothing to give it fuel for it to work. So high protein diet, low fat, low sugar, no fried foods, lots of fruits, lots of vegetables. Cut out the soda. I'm a Dr. Pepper lover, so it kills me to say that. But you don't have to eliminate it from your diet, but it's just, looking at modifying it and just keeping your servings small and allowing yourself to have a cheat day, but keeping on your diet is how your body is going to have the fuel to regain its strength and to function properly.
A little bit about you, Lindsay. What made you go the stroke route in all of your medical learning?
So this is a question I get quite frequently because I can tell you I did not think I was going to be in this role 10 years ago. I didn't even know what this role was 10 years ago. But, through my healthcare journey, I started my career in healthcare almost 16 years ago. I was a paramedic in Baltimore County. I've had my paramedic license for 12 years. After that, I was an ER nurse for 7. But none of that, all of that medical training did not prepare me for 8 years ago. My stepfather, who was 55 at the time, he was young, healthy. He was also in the fire department. He was a firefighter. He played in an over 50 soccer league, twice a week. So they were running for 90 minutes straight. He was otherwise healthy, took no medications. He unfortunately did suffer a very large ischemic stroke 8 years ago, which left him paralyzed. So, at 55, he had to medically retire. And, looking back on that, he had an irregular heart rate. So he had AFib. And, no one told him, even seeing, a cardiologist. So if we had put him on blood thinners, would he have had his stroke? Probably not.
Wow.
So I've seen it,
from. He didn't know.
He had no idea. He had no symptoms. So, all of that training did not prepare me to sit on the other side of that fence. And, being the family member, and I will never forget walking into the emergency room and seeing Dean and looking at him and saying, "Dean, what happened?" And he was so aphasic and, had expressive aphasia, he couldn't respond to me.
Right.
So, years of taking care of these patients, him and I, as a paramedic and as a fireman, it's very scary to be on the other side of it. So I think that's, why I am in the role that I am, because that's where God put me, and I'm carrying out the mission.
Yeah. Thank God for you.
I have the best nursing job ever.
You do?
I do. I truly do.
That's great. That's great, Miss Lindsay. I wonder, you had scared me a little bit because strokes are scary. You don't know where they come from when you're having one. Both of mine was different. Then I have the seizures upon the strokes. The group that you develop, how much of it is it about the inside and the mental part of the stroke?
Almost all of it. And honestly, it's when people suffer strokes, and it's something that I've never had a stroke, so I can't speak to it from that side. But what patients tell me is, you have a stroke, it's life altering. So even if, outwardly you can move everything and, function and look like a normal human, there's still, cognitive deficits. A lot of people have post-stroke depression. That is something that is overlooked by neurologists, by cardiologists, by primary care physicians, and we see it in a lot of men. A lot of men that were not emotional, didn't like to talk about their feelings before, have a stroke, and now they're emotional. That's, scary not just for them, but it's scary for their family, where this is a different person. And, it's post-stroke depression is something that cannot be overlooked, because it will truly kill someone before the stroke will, because it's a lot of these people that, are young, just like my stepdad at 55. Imagine not having the capability to work or drive or provide for your family, or, to be able to fix something in your kitchen for your wife, or, to cook dinner for your spouse. And that post-stroke depression is something that no medication can fix solely. You need to have a support system. And yes, your family and friends, are a great support system. But until you've talked to somebody else that's had a stroke, they're always going to think, why me? But these patients, just like you, DJ Porkchop, are not alone. There's a lot of people that go through the same exact struggles that you do every single day. And talking to other people that have had strokes, they can teach you how to mitigate that. And that's something that I can't teach you as a, stroke program coordinator. That has to come from someone who's had a stroke in the past that has gone through it. And
I'm sorry, I will tell you, like we talked before, that's where I'm at mentally. I can tell you now that what I didn't tell you earlier, that I really thought I was going to end it this week because don't have nothing to do about, everybody be like, well, what about your son? What about your mom? What about that? I feel like I understand that, but no one knows that feeling that I'm going through inside of my body every day. Like the entire time we sat here, I don't know if you saw me moving. Like I always got to move my neck because it always hurt. My head always get these headaches. And the headache started maybe 6 months ago. Me telling you about the feeling in my left side, always just feeling like pins and needles. I can't, it's just certain things that's over a year of figuring out when will it get better. And then to now understand that it might not get better. Like this is it. This is how I'm gonna have to live the rest of my life. And it's just, I can't wait the next Wednesday to come to the group because I'm really going through it right now, mentally, physically, spiritually. Like
And honestly, post-stroke depression is something that is so overlooked, and you feel like, a lot of my patients tell me they feel like they're a burden. So they understand, like, yes, you have to live, for this person, that person, this person, but you don't want to feel like a burden to them. And a lot of times people tell me I don't feel like the husband, wife, father, brother, sister that I was before the stroke. And your feelings are valid and warranted and, understandable, because your brain truly did go through war. And it's not just, a physical aspect, but, it's a chemical imbalance that happened in your brain that you have no control over. And it's no outside external thing can fix. You have to work on it from the inside out, is what my patients have told me. And when you meet my group, you're going to understand.
It's very hard to be a dad with a growing boy. My son is 10, and not being able to be active. I'm here. We could play a little bit, but I can't go to basketball. I can't run. I can't do so many things. And I feel like that's a part of the depression as well. Like when you just can't be yourself, even when music is my muse and what I love to hear and play, I can't dance no more. Like that's out. So
and that kills you. That's life altering. And it's understandable for you to have the feelings that you do, but you need to change that mindset. And I'm going to use you to help me educate the public. And I'm going to give you a mission. And
what is it?
To educate the public on stroke. Yep. And I go and I teach to nursing schools. I teach to paramedic programs. I teach to Anne Arundel County, Baltimore County, fire departments. And I bring my stroke survivors with me. I've brought a lot of my survivors to the news and given them that purpose. And, you don't understand, just by educating one person on your story can help save somebody's life. And hopefully, at least one person, after looking at us talking, hopefully learn something, that if they see this or recognize this in a family member or themselves, that they know to call 911 and truly save a life.
Like it scares me, Lindsay. Like people don't understand that when I wake up and go and walk out this house, 8 times out of 10, I think about what if I have a stroke again? And what if it's the last one? Or what if I'm driving and have a seizure? Like all of that bothers me because my son saw one of my strokes and he also was there when I had my seizure. So,
Mhm.
it just is bothersome inside. So I feel like this was more than just stroke awareness with you. I am trying to release something that's inside me. And I'm glad it's with you, Doc.
Oh, well, thank you. You're going to hear Wednesday, and I think your perspective's going to change. I'm hoping. And I think it will, because I have seen, many, many patients come through that group and be at the lowest of lows. And now they help me and they switch their perspective, and, they truly do recognize they're a survivor. There's a reason why they survived. And changing that mission and just going out and educating can truly just save one person's life, and one person's life saved is worth it.
I'm sorry.
Don't be sorry. It's Your feelings are valid, and you're not alone in that. And that's a lot of my patients. They think it's just me, and they feel isolated. They feel like they're on an island, but you're not alone.
I feel like I can't do nothing. It's just so much.
It's truly, and the difference with stroke and any other disease process is, from the very minute that your brain started to bleed, your life was changed forever. But not just your life, your family members' lives were changed, your friends' lives were changed, your coworkers' lives. It's different than any other disease process that we have, in the world, because of that. That very moment is life altering. And, stroke is the number one cause of long-term disability in the United States. And how long does it take for my patients to get on disability? A hell of a long time.
Yes.
And which, isn't fair. But it's, you have to look at, it's changing a perspective, and you're here for a reason, and God kept you here for a reason, and it's to make a difference. And I think you're going to.
I can't wait to see you next Wednesday. Well, 2 Wednesdays.
2 Wednesdays.
2 Wednesdays.
You're gonna love this group. It's not a cry group. A lot of people are hesitant about support groups. You have cancer support groups. Everybody sits in a circle and cries. This is not the case. These people have truly taught me why I do my job, and given me a reason why. It's, to the point where we've, as a group, started writing poems. And who thought you'd be good at writing poems? I didn't think that I was. But you're going to engage different parts of your brain. You're going to learn a whole different part of you as a person. And there's a reason why. You have a mission, and God put you here for a reason.
Thank you so much, Lindsay. Let's end it off right then. Right there. University of Maryland Medical Center, Midtown campus, building up the community with Lindsay Goff, my new doctor. We're going to get you this money to go back to school, Lindsay.
Oh, I wish.
It's coming. Yeah, but thank you for everything. And the number to contact her is 410. I'm waiting for the screen. 8,000. I was looking at the bottom screen like, why that number ain't going so slow?
I'm going to be impressed if you memorized it.
Man, I would have been impressed. I can't remember nothing after them. The second stroke really was like, all right, memory, because I already had a growth that they found on my memory. And they said the second stroke is right there on that part. Like, I was like, well, I guess people gonna think I'm lying when I don't remember you. I don't.
Exactly. But it's something that outwardly we can't tell just by looking at you.
Yeah.
And it's hard. But
Thank you so much.
You're gonna have a different perspective.
I can't wait to see you.
Oh, we can't wait. This group is amazing.
And for everybody that joined us, we appreciate your time. and make sure you know the be fast for someone else if they're going through it. All right. And that's don't tell me. Don't tell me. Balance, eyes, face, arms. Hold up, S. Give me a hint. Speech and time. All right. So
Time
make
and
sure
brain.
you be fast in checking your loved ones when it's that time.
Yes, sir. Thank you, guys. Thank you for joining, everyone. DJ Porkchop.
You can take the DJ off. I'm regular old pork chop. Little seasoning on there.
Whatever you want to be called. If I'm Doctor, you're DJ Porkchop.
Dr. Chop.
Dr. Chop.